You.
Somebody did it for me. Okay. Good afternoon and welcome to the Wednesday webinar on April 10th. My name is Melissa Sparks. I am the HSEA president-elect and a health science teacher in North Carolina, and I'm very excited to have you all here. Today we have clinical and employability skills for health professions presenters from GW Publishing. We have 4 presenters. Abby Hess is the GW Publisher Market Development Manager. I'm probably saying that wrong. But Linda Stanhope is a Texas New Teacher Training Specialist and a retired teacher from Amarillo. Kimberly Turnbill is a health science teacher and nurse training competency evaluation program director in Abilene. And Deborah, I'm going to mess up your name so badly. I don't want to do that. Is a health science instructor also in Abilene and an Air Force veteran. We thank you so much for your service. So I am going to remind you that at the end of this webinar, you will, well, not at the end, but after the webinar, we will have, okay, I'll start over. After this webinar is over, you will in the next week get a certificate for 1 hour of PD to help you with your renewal of your teacher credit. We want to remind you, and I'll remind you again at the very end, that there is an end of year celebration for our school year on April 24th with all of the HSEA officers being here. And don't forget that we have a national conference presented by NCHSE in October, on October 15th through the 18th in Glendale, Arizona. And we would love to see lots and lots and lots of you there. So at this point, I'm going to turn it over to Abby, who can take it away.
Okay, thank you so much, Melissa. Like she said, my name is Abby Hess, and I'm the Market Development Manager at Goodhart Wilcox Publisher. And we want to thank the National Consortium for hosting us today with this webinar. As she mentioned, I'm joined by 3 health science teachers and GW authors who are going to share a wide array of ideas, activities, and resources really meant for the capstone course for health science pathways. And whether you call that clinical rotations, health science practicum, or something else, this session will focus on how to be prepared and flexible for the varied needs of students in clinical sites from year to year. And so Melissa shared a little bit about our speakers, but just a little bit more. Linda is a retired medical technologist and taught health science at Amarillo in Texas for 24 years. She currently works with the first-year health science technology instructors in Texas as a new teacher training specialist and aids organizations and districts in staff development and training. In addition, she works for Texas HOSA on the competitive event team. And throughout her career, she's earned major awards, including Health Science Lifetime Distinguished Teacher Award and Texas Health Occupations Teacher of the Year. She holds a Bachelor of Occupational Education from Wayland Baptist University. And Kimberly is a health science instructor and nurse aid training competency evaluation program director in Abilene, where she's taught since 2004. She earned her BSN at Morningside College and her certificate in applied technology training and development from the University of North Texas. She has nursing experience in medical surgical nursing, skilled nursing, intensive care, and home health. And she's earned multiple awards for her outstanding achievements in health science education, including the Texas Outstanding Teacher in Community Service Award from ACTE, Teacher Tribute Awards from Abilene High School and Holland Medical High School, and the Abilene Education Foundation Science Teacher of the Year. She's also a member of Texas Health Occupations Association and HOSA, and has served as a board member for HOSA. Both Linda and Kim are co-authors of the GW textbook Introduction to Medical Terminology, now in its 2nd edition. And then also joining us is Deborah, who is a registered nurse and Air Force veteran, and she's currently an instructor and HOSA advisor at Holland Medical High School. She's the director of the First Aid Program and Technology Liaison, and most of her years of nursing experience were spent taking care of new moms and their babies. She worked in the labor and delivery, mother, baby, newborn nursery, and NICU, and has also co-authored a resource for the Center for Excellence and Multimedia at the Air Force Academy on prenatal education for new mothers. So I'm sure you're excited to hear from them, and we will do that very, very soon. I just wanted to let you know a little bit more about the resource that they are currently authoring and working on, Clinical and Employability Skills for Health Professions, which will be a digital course available next December. But during this session, we'll discuss how health science teachers, clinical site affiliates, and health science students' needs change from year to year. But the meat of this presentation will be a sharing of ideas and activities, as well as some resources from bell ringers to on-the-job scenarios that you can use in your classroom. We have some examples within this PowerPoint, which we can send out to everybody who registered after the presentation. I'll also have a link I'll put in the chat for you to download it. But feel free to use the Q&A in the chat as we go along. We're hoping to have some time for questions, but if you have a question about something that our speakers are talking about, feel free to put it in the chat and we'll try to answer it live. Clinical and Employability Skills for Health Professions will be a one-of-a-kind digital course, including student-facing content, assessments, and activities, paired with the resources teachers need to implement work-based learning for a health science program, whether that's with a clinical site affiliate or in class. This course will contain opportunities for students to refresh themselves on foundational knowledge they've learned in prior health science courses, as well as new professionalism and employability skills they'll use in their future career. It will include work skill competency checks, which are tools for students to prove mastery of the hands-on skills they'll need in their clinical rotations. And students will work through activities that set expectations and confidence while in a work clinical setting outside the classroom, with chances for them to reflect, practice the writing skills, and gain experience with a wide range of specialties and facilities. And this, we do expect this course to be in the GW Ignite digital platform. If you haven't seen GW Ignite, we do offer it across our health science titles, which are aligned to the National Consortium Health Science Standards. And it's a digital platform that includes the e-text reading with auto-graded activities, video, and grading tools for teachers. So with that, let's start our conversation now. First with the needs of our students. What do our students need for successful work-based learning? Deborah?
All right. I apologize that you can't see me. I was having technical difficulties, but you saw my picture, so you just have to pretend you can still see me. One of the reasons that we thought this would be a good product is the students come to us a lot of times somewhat non-communicative and timid and not wanting to do a lot of interaction. And it's so important that they act as professionals in the clinical setting. So we wanted to give them a good foundation. And once they get that confidence and they feel like they can do it, they perform much better in the clinical setting. So we wanted to give them just a better understanding of the application of the whole process of preparation and going into the clinical setting and taking care of patients. Sometimes we have to refresh some of their knowledge and skills. So we have things that are going to be built in to do that. We really emphasize professionalism and employability skills. So that will take them beyond the clinical setting into the workforce as well, if that be right after high school or after college or whatever their choice is. So we try to make our expectations really clear. We try to reinforce the skills that they need to give them that confidence and to be successful in the clinical setting. Lots of hands-on practice, lots of skills checklists and things like that that boost their confidence, give them the knowledge and the skills that they need to perform well. I think that sums it up.
Okay, so the clinical site affiliates. So I kind of went back into our Dropbox where we have all kind of dropped some things that we use from the classroom and then in the past. And even though there may be affiliates outside of the really realm of your classroom that you might use, sometimes you have to think about your own lab as being a site where they have to have practice. So there are some things that are in our resources that you can use just in case they can't be in the clinical site, such as a bank of residence and what they might look like, alternate assignments for those students that may not be able to attend, and then some also the skills lab protocol, which kind of helps out with what you are expecting in the lab setting. And so that's kind of a teacher help as well. But basically, when you're beginning to look at affiliates, and you probably already know this if you've done this, you need to start early. And early is better. You need to keep contact with your affiliates constantly. I would say probably on a monthly basis, if not every other month, just to make sure they still want to be your affiliates. We have dropped some example basic affiliation agreements in Dropbox that we would like to share with you. Some, it just depends on what you have. For CNA, it just goes a little bit deeper. That's where my experience is. And so a lot of times the sites that we use for CNA might be just a little bit deeper, and we have to work with the lawyer part of it and all of the logistics behind that. And so that might take just a little bit longer for that. So again, start early with that and communicate often. Always update your contact list with them just in case it might change, phone numbers, emails, and that sort of thing. But what we really want to say is, you know, we as teachers have that experience in the workforce as a healthcare worker, but we need to help our affiliates with how our students actually should be looking and be acting. And so we would like to give you all maybe a tool for assessing them with their soft skills, task sheets that Linda is going to talk about later on, just experiences as far as the list of skills that that they may require and need the students to do. Just keep those communication lines open so you can have your student ready to go. Also, every affiliation is different as far as the sites, because they may require immunizations, they may require drug screens, background checks. The list is endless and it's all individual. So we've actually had to start a spreadsheet for our CNA rotations. It's helped us tremendously. And that way, going forward, we already know that this site, and of course it does change or can change from year to year, but a lot of times, you know, it's just all so different what they require. And so just, you know, keep those communication lines open. Let's see, if you have any other ideas, please enter those in the chat box, because we can always help, you know, with building those resources in too.
Okay, so on that note, yes, I would like to actually give you guys an opportunity for each of you to share with us in that chat box some of the struggles or / roadblocks you're having this year with your clinical areas. We would like to see if we could address a few of those just on a basis right here today, or maybe at the end of the question and answer session. But as teachers, we're hoping that this is going to be a really valuable resource that you guys could utilize. You know, some of you walked into a program where you already had lots of mentoring stations. You already had a program that was built up, and that is a wonderful thing. But some of you are starting from the ground zero, which means you have pretty much nothing. And so that's one of the reasons that we felt like this would be a resource that a lot of teachers could use, because we're seeing a whole lot of turnover in the health science area, where a lot of new instructors are coming in and a lot of us older instructors are retiring from the classroom. So we thought we would at least share, you know, some of the ideas and some of the things that we found in making those relationships and getting that program up and going. But, you know, the other thing is teachers, you know, what are you going to do, you know, with kids, as far as like, how do you take attendance when it comes to clinicals? How do you, you know, some of you are going to be doing clinicals in one particular institution, but some of you may be doing clinicals at like 12 different areas in one, you know, one class period, because you've got a kid here and a kid there. And it's like, how do you take attendance? You know, what do you do if a kid misses clinicals? We already give 60, 70 hours of our week to our lovely little students as a general rule. Weekends are generally not something we're hoping to do as far as make up grades. So, you know, we've tried to put in there a lot of suggestions on what to do, you know, for those kiddos. That's why we came up with certain worksheets and things like that so that you could recoup that grade. I know campuses are getting harder and harder that you cannot give kids a 0, but if they're not there for clinicals, it's very difficult to make up that time. So this is one of the things that we felt like, you know, would make a resource like this very valuable to teachers. You know, and basically, you know, just the time that it takes, how to build those relationships, some ideas of maybe places to go for those relationships that you had never thought of. One of the stations that my kids ended up absolutely loving at the hospital that you might not think about was actually Central Supply. You know, everybody wants to go to the ER and to, you know, labor and delivery. But we were able to find a lot of other stations that really wanted students, that the students really, they took the time to teach them a lot. And the kids were able to get their foot in the door at those basic level jobs there at the hospital, which give them a big step up, you know, with feeling very comfortable in the institution. So, you know, there's lots of pros and cons and tricks that we can share with you guys. All right, so let's take a look real quick at our chat. It looks like I'm seeing some hits. Let me see if I can pull that up real quick. So going back, Abby, are you pulling it up so they can see the question too?
Yeah, I don't know if you can see the chat when I pull it up, but Paula and some other people were saying that they've had an issue where even when they've had a program that's been around for a while, some long-term care centers are being put on a loss list where they can't send students anymore. So they're almost losing options that they might have had in the past.
Yes.
So I don't know.
Kim, I'll let you address that. That's your specialty.
Is allowing the training to actually be performed in the assisted living facilities and hospital based. And so that's what we are starting to do, because we have run into the same thing. Our favorite, all-time favorite dementia and Alzheimer's unit is, we won't be able to go there anymore. And so, at least for 2 years. So we're going to have to go search for another alternative, because I think that is so important for the kids to be able to experience, because that's an added layer of care where they just need to know how to do. But Abby, I can't scroll down. So can you and I asked about that. Are other states able to do that?
We had some people saying that the Department of Health and Senior Services in Missouri has to regulates CNA in their state. So it has to be approved by the Department of Health and Senior Services. It seems like in some states. We did have, Rochelle said, another problem is that there's a lot of competition with other schools in her area where students are not allowed to drive to clinicals, and that makes it hard for the whole class to go at once as well. I don't know if we have recommendations on transportation. That's interesting.
So yes, so, you know, that's something that I ran into quite a bit actually at my campus. And so sometimes, you know, the kids could carpool with another kid, but we actually had to make a particular class where at that capstone level there, that the kids knew that they would be going by bus. And so we actually had to you know, facilitate a bus where they took that whole class to a particular facility and picked them back up. That was just one more like hoop you had to kind of like jump through. And by non-drivers, that was the class they had to be in. You know, my ones that could get transportation back and forth, then they had more opportunities at going to different places. But as a facilitator, I had to come up with an option for those students that didn't have that transportation. And that was one of the methods that we used, was actually creating a class where the kids already knew that they would be going in. And so we did things from everything from like health fairs to, you know, going to the senior citizens and taking blood pressures. And, you know, we may go to a school, and we're going to visit with you about quite a few of the different alternatives that you might be able to use as a you know, possible lab area. At the campus that I was at, we had 6 other schools that went to the same hospital. So we were definitely on a rotation basis, because they were not willing to take all of the students all of the time. So I totally understand that. And we'll try to share some of those with you here in just a little bit.
Okay. Yeah, so we like I think Nancy said, we'll share out the link to this PowerPoint, because the next stage of this is to show you some sample activities and sample things that you can do either with students while they're at their clinicals or when you're in the classroom. But you can scan this QR code or go to this bit.ly link, which I will hopefully be able to add into the chat while I'm sharing, but we'll definitely email it out afterwards as well. But keep putting questions in the chat or ideas with each of these if you have something you want to share. So Deborah.
Push the wrong button. Sorry. My camera, you can see there, my camera wasn't working. So I'm going to talk about bell ringers, which in my class, I call them noggin joggers. I mean, we all know that students often forget what we've talked about as soon as they walk out the door. So this is meant to help kind of jog their memory, as the name implies, and just help them focus. We were talking about the other day how they're really busy too, and they're running all around. So to kind of focus them back on the subject that we're talking about. And so I use these in lots of different ways for clinical preparation, for recapping information, and we are compiling lots of different kinds of noggin joggers to use. Sometimes they're straight on questions, sometimes they're diagrams they have to label. I typically show these on my Promethean board in the front of the class. Sometimes it's a safety checklist. We use that in the CNA class a lot. Like write out what your safety checklist would be to do a safe transfer or to ambulate your patient. Sometimes they're math problems to get them used to doing the pharmacy type of dosage calculations and different kind of math problems. So hitting some of those core skills that they need to brush up on. Equivalencies, like, you know, how many milliliters in an ounce, those types of things that they use all the time in the healthcare setting. We try to hit med terms, the important ones, especially to help review those. And again, keep those more forefront in their memory. A lot of times we'll do scenarios. I use those a lot when I'm teaching first aid, or sometimes they're behavior type scenarios, like a type of what would you do in this situation. These can also be used as exit tickets, or sometimes it can be used as a group activity. If it's a scenario, you can have them discuss in a group, like how they would handle the situation, and then have have them discuss if that's a good way or not a good way to handle it. Sometimes they're to recap knowledge. Sometimes I pull them out to use them as a grade. For example, like if we're talking about infection control and the chain of infection, one of the bell ringers for that day might be that they have to draw their own chain of infection. So they would have to come up with whatever pathogen they wanted to use, and then they would have to designate what the different links in the chain were and label those. And they do get an overall grade for those, or as I said, you can use them individually as a grade too, depending on what you need for your grade book.
Scenarios. So Deb touched on that just a little bit. it brings the realness to the classroom before they actually go into the real area. And I think this is a huge asset to any work-based learning course that you might have. This one in particular that you're going to see on the screen has the workflow of what you might actually have to wear in the situations where you have contact isolation, airborne isolation, or droplet isolation. A lot of times for CNA, we do the behavior scenarios, which helps them out with different behaviors that they might see in the dementia and Alzheimer's unit, which is, I think it's the most fun, honestly, because there's that extra layer of care that you give. But we've started to drop more information in there. I'm just going to kind of go through some of the list. I know at the very beginning when we worked with the professionalism part of really the background of how the kids should act professionally, we did some how, like what would you do as far as what is a don't and a do in a situation where it was an interview, and then communication practice for those that have deficiencies with hearing, vision, also subjective and objective information that might be different in those type of scenarios, and verbal and nonverbal types. There's that, and honestly, that whole module of medical math that Deb has created and Linda has dropped in some things. It's basically all scenario based. And so that helps them with one of the concepts that they really don't care for, which is math. But when you add in the word problem and the scenario, it makes it so much easier. And I guess it gets the concept a little bit more when you actually have something that it relates to the real deal. We've got vital signs scenarios and infection control, bed safety checks. You can do something really crazy and set up your bedside that doesn't look very safe at all, which is kind of fun. And then they have to list the 10 things. The medical ethics is always a good one, where you bring them into a situation where you have this critical thinking and morals to talk about, where the confidentiality piece of things, and then also your actions outside of work with coworkers that you may be put in. So those are some of the things that we would like to do. And I think the scenarios are just a way to kind of capstone the ideas in each of the modules. And, you can use them as bell ringers or noggin joggers or exit tickets as well.
And Kim, you said that sometimes or in the past, you've even brought costumes or props to help students get into their role.
Yes, especially for the behavior ones in CNA class. When we address the behaviors, we actually have a tub full of hats, glasses, scarves, hair accessories. The kids go wild over that, and so it makes it real, and it actually helps them understand how it's very individual what the person looks like. And so it's quite entertaining when they really jump into the role of being a resident. But yes, costumes are a great idea. Makes it real. Mm-hmm.
Cool. And then Deborah, skills checks. Yep.
Oh, sorry, that's not what I had next. All right.
My bad.
That's okay. I'm just falling behind. So the skills checks, that's a good way to, again, ensure they're ready to be let out into the clinical setting and work in a professional atmosphere. So it's one thing to learn it in a book, and another thing to actually do the skill. So sometimes they need a little brushing up on that. So we go over the skills quite a bit, C1, right? They learn about it, and then they do it with each other. And we'll talk a little bit later about using the students to also teach it, because that's also a really good tool to use. But we have lots of skills that are their peer check. So after they learn it from the instructor and get the standard of care for the skill check, then they practice the skill and then they check each other off. And that's a good learning experience for the students. And they get really good at it that way, because it's funny when they're watching someone else do it, they can really hone in on what steps are missed or what things are done really well. And so we've been working on different skills checkoffs that we use in our classroom, and that the students can use to learn the skills and also prepare themselves to work in the clinical setting.
And
So you
also,
see some of, I'm sorry, just because you see some of them listed. There's more than that, but there's some that you see listed there on the slide.
also, if and this is kind of like the module that we have. We would like your feedback from this group particularly. How much information needs to go in these modules and these skills? We personally think that these are basic skills that should have been addressed and taught and practiced in a prior course in the health science. And so we wondered, from your experience, how much information should be in the modules that actually, or the sections that just go along with these skill sets. Because right now we've just got a short little, this is how you do it, and this is your peer check. So we'd like your feedback. Station labs. Okay, so I know we talked about alternatives for doing the clinical rotations. This might be something to think about when you cannot get to a clinical site. And while I'm thinking about this, maybe the transportation issue, especially for CNA, and it worked out really well for us. We ended up actually blocking off a whole day and excused the kids, the kids the entire time. And we had an 8-hour experience. So that might be an idea that you all could propose to your administration if they would let you do that. That way they could get the 8 hours of experience. I know for those that are not in CNA, where it's not a requirement, or maybe you could, that might be kind of a cool thing where they could go a half a day and get excused from part of the class. But if you can't get to your clinical rotations, the station labs is a great idea. So what you're seeing right here is an example of one of the station labs. So I'm just kind of walk you through. This is really kind of built on the professionalism unit, where the first station or table is the interviewing skills, and the envelope at this station contains a sample interview questions. Takes turns drawing a question out of the envelope and ask your group questions. So the second station or table is body language. And so each of the slips of paper found in a bowl at the station contain common terms seen in the workplace. Nominate a team member to go first. That person should choose a paper and act out the term using only body language, no verbalization. Other students in the group should try to guess the term. Station 3, don't do it. Use a scrap paper provided. Spend 3 minutes listing things you should not do during an interview. And this is priceless, because when they get close enough to actually go into that interview stage, and there are so many things that they don't think about that they do that you see in the classroom, and you're like, shouldn't do that. But if they come up with the ideas like, don't do that, it seems to be better when a peer says, don't do that, than a teacher, because they take much better criticism from their peers. Try to come up with as many as possible at the end of the 3 minutes. Share your list with the other students in your group. Then on a second sheet of paper, write down things you should do during an interview. Station 4, dressed for success. And that's pretty much speaks for itself. Give your ideas on, and then also teacher input is always good with this, because things change over time, as you've noticed, and what is professional and what's not. And so this is always a good thing. But your ideas for that. And then taking a phone message, because kids, they text. They don't know how to answer a phone. And so this is a really good experience for them to practice if a caller should call. Of course, we teach them that if they're in the clinical setting, we don't answer the phone, but when you are actually, wanting to be hired, or if you're actually in those rotations, you may end up having, getting the opportunity to answer the phone. And so this is also one of those good practice sessions. And then, of course, the art of a thank you note. And that's a great follow-up to bring your resume right to the top of the stack and be able to be noticed again. And then, your inquiry, you get a feedback of thank you for the thank you note. And by the way, would you like a second interview? So those are the different stations in this specific one. And just hearing your concerns about the transportation issue, I feel like we need to add more of these station labs that can help you out as alternatives for days that you might not be able to get your kiddos to clinical. Current events. So this is a great way for your kids to do research and kind of take a break from, the general topics of the day, but still being an extension of what they need to know. This one specifically has to do with infection and microorganisms, which is kind of my favorite thing as well. But basically, this scenario has to deal with doing the research, finding the bug, and then coming back after you get the research and then disseminating the results to your classmates and to your teacher. We have built rubrics with the current events. Current events actually pair very well with competitions, either HOSA, Skills USA. They can be prepared as brochures. They can be prepared as education, PSA, public service announcement, career health displays, and that sort of thing. We do have rubrics ready for you in those that cross over very well. And so that should be a really good time saver for you to be able to use. And it gets them interested in competition and leadership. And it's a great way to get them to be a better speaker in their realm as well.
Okay. Next is we're talking about mini lessons. But one of our goals with this was really to make things easy for the educator to use. So not a lot of prep work on your part, things that you can just grab and go with, because most educators have worked with a lot of these different things. So to make things easier for you and less time consuming was one of our objectives in putting all this together. So some of them are the PowerPoints, like this one you see here is for resumes. I saw someone put in the chat that they do also resignation letters, and that is also a good point. You do need to be able to also exit a job professionally as well. So we talk a lot of different aspects about that. There's a lesson on like writing the thank you note that Kim mentioned. My students all have to write their clinical site a thank you note after they're there, just to let them know that they appreciate the time and effort that they put into it. So this is just a little short PowerPoint that goes over the steps of a resume. It gives them an example. It talks about how to do it. We usually get them started in class, and then depending on the time frame, sometimes they do need to work a little bit on their own. But it goes over how to put one together. It has other things that go along with the lesson is a personal inventory that kind of gives the students a starting point. They can kind of take a look at their strengths and weaknesses and experiences, and they write all those down, and that just gives them a launching point for their resume. Sometimes they go into vapor lock when they're trying to think of just writing a resume. So if you have them start with kind of writing some of those things down, that helps them with the resume planning. There's a template for a resume that's included, and also Kim mentioned rubrics. Sorry, that's my bell. That are in there, and so there's one included for the resume. And so any of these things you could use or tweak or not use depending on what you were trying to do with it. There's also, we try to include activity prep and notes, lesson plans for the lesson, things to get you started. Again, still you're able to tailor that to whatever your student need is. But in this one particularly, they are going to organize their experiences using that inventory that they have and then build their resume from that. And then you can build a portfolio out of that too. That's just one of the pieces of it. And so there's different things that will be in this product that you can use with your students and pick and choose which ones, again, that you think are best for your student population. Then some of them will have questions to follow up, like where could they use this resume? What job, if they could have any job in the world, which job would it be? And sometimes I'll have them write a resume for that, for like their dream job. So there's different ways you can do it. And we talk about updating resumes and how to present them and different things like that.
Okay, so we alluded earlier that, we had some ideas for what can you do if you are not able to go to a regular type of rotations, station areas. So, but basically, as your future healthcare professionals, your students need to be comfortable with communicating and educating the patient and clients they work with. And so I started pushing the basic ideal that students needed to become educators. And so there's lots of ways that you can actually get the students involved in teaching others. One of my stations that the kids always wanted to go to was PEDS. And it seemed like we were always there in the middle of winter, which is RSV season. And the very first thing that the PEDS section would say is, we don't want anyone but their parents up here. Not you, not nursing students, not high school students, no one. So they were ixnaying that area. So, my kids who all thought this is just the area that they would love, it's like, I'm so sorry, I can't get you into that area. So came up with the idea of actually partnering with the elementary schools at my school district. And it worked out so well the very first year that we just kind of kept expanding year after year on that. But basically what we started doing is instead of going into the hospital, I would get with a couple of the teachers there at the elementary schools and see what lessons because they have TEKs that they also have to address about helping kids with like hygiene, that kind of nutrition, that type of stuff. And they're very thankful for having additional new people in there to kind of help out with that. So basically I got my kids to using, once again, we went with actually using that first year, we started using the HOSA health education rubric to kind of help them and guide them with what they needed to do. But my kiddos, they had to come up with lesson plans, activities that they would use to get the kiddos started. And they partnered actually with we partnered with the elementary school. And so my kids would come up with ideas for like dental hygiene, hand washing, fire safety, bullying, nutrition, not how not to be a couch potato, so physical education. And sometimes we would partner actually with like, the kindergartner, first grade, second grade class. One of the things that I really stressed with my kids is that if you're working with these kids, your activities and your lessons have to be geared towards the actual age of the student. And that's real helpful when you're working with patients. It's like you're not going to talk to a fifth grader the same way you would talk to somebody in preschool. So, I always took it back to how you would be using this later on in the workplace. But the kids really got a lot out of it, and they came up with some really creative ideas of what they wanted to do with the kids at the elementary school. We would practice the lessons there at our campus, so I knew exactly what was going to be presented. I'm not one to like surprises out there in the real world, so it's always good to have them show you and demonstrate so I can ixnay something that I feel like, the elementary school teacher would not appreciate. beforehand. And then we actually bounced from several different schools. So we had a whole 6 weeks that we weren't able to go anywhere as far as like a clinical because of all the other campuses having those stations filled. And so we went from, 1 week we went to, we had a solid week of doing nothing but planning the lessons. And then we practiced the lessons the first couple of days of the next week. And after that, then we started going from campus to campus to campus. And we have 32 elementary schools in Amarillo. So we had quite a selection, but I picked campuses that were really close to our campus so that it made it a little bit easier to drive there and back. The kids really enjoyed that so much that even though we actually started back to the stations, they still wanted to keep on going ahead and doing this, and they wanted to go into the middle schools and introduce to them the dangers of like alcohol and drugs, because they knew already that kids, the exposure they had while they were in the middle schools. And so this was a really great area to do that with. And then they still wanted to keep on, like I said, a couple of years later, they were like, well, why can't we even do something in the high schools? And so at that point, we started doing like little PSAs, and they would put them on the announcements and, utilize it that way about different things that they were trying to get that information out. So it really just kind of grew that my kids became student educators, and it was great practice. Just talking to people that they're normally not talking in front of, they became so much more comfortable with their communication skills. I know Kim and Deb also use a certain type of activities. I'll let them talk real quick before I go on.
Do you want me to go, Kim, or do you want to go? Oh, okay. So I incorporate education a lot when we do our skills in class. So utilizing those skills checkoffs and including like real patient education that you would do if you were doing it in the clinical setting. And that's part of the skills checkoff, that they have to do the education part. And like Linda said, the more they do it, the more comfortable they get with it. I also do some different projects in class and have the students, for example, when we talk about mental health, they each pick a mental health disorder, and then they have to educate the class on whichever mental health disorder that they have chosen. And they can use a PowerPoint or a trifold or however they want to do it, but they have to teach the class about that particular ailment. And they are nervous the first couple of times we do it, but by the end of the year, they're more comfortable educating their peers. Go ahead, Kim.
Oh, yeah, we do a lot of student tours, and our students become the educators to all of our 4th graders that come through, the 8th graders that come through. We have a Hello High School that happens, and some of our top kiddos go and they talk about the different programs. And we also use our students for the program meetings for our upcoming year, and they do a very fine job with educating what they do in the clinical setting too. And so all of them become good speakers because they have to.
It's awesome. I wonder how many, younger kids you encourage to go into the health science pathway in high school, because they get to interact with your students when they're younger. There were a couple people who shared some cool things that they do too, from having their students partner with special education programs on campus to learn hand washing, to utilizing school nurses for students to observe them and to identify what lessons might be needed, and helping arrange days and times, to having their dental assisting program go to local schools and teach the younger kids about dental hygiene. So awesome. I know we're running short on time, Linda, so I apologize. We might have to go through these next ones kind of fast.
Okay, really quick. So one of the things that we felt like was going to be a really great resource for teachers is we did what we call preclinical worksheets. And the worksheets are worksheets that are designed by clinical areas. So say they're going into the picture that you're seeing up there is cardiology, but the thing says example urology. So I'll give an example on both. But for instance, if we're doing cardiology, there's a bunch of questions that basically it's going to ask in any area there, the basic anatomy that you really need to know before you're going into that particular specialty area. You know, what are the common medical terms they're going to use? So the common conditions that the students might see. You know, kind of retraining them and letting them go back and think about, you know, what kind of testing is normally done with patients in this area. So, you know, this kind of, what kind of treatments should I expect to possibly see, you know? So this can be done in class or as homework before clinicals. But we've got over I think 27 of them, so there's lots of different areas. You know, some are in hospital, some are out of hospital, you know, some are you know, just various different ones that you might possibly consider putting your student into. Okay. And then we have one which I call the workplace discovery worksheet. And that one's a little bit different, but basically it is going to be one that you, the kids take with them. And so they're going to be asking questions, say, for example, if they're in the emergency room, you know, what is triage? And then they have to describe the process for triage. Some of these might be questions they're actually asking their mentor. Others, it's going to be just, you know, they're filling in the answer to this. It's like things for them to be looking for. I don't want to say it's like an Easter egg hunt, but basically they're looking for certain things there at the site, you know, and it, there lists the equipment found in a standard patient emergency room. We all know there's times sometimes when they get to a clinical area and sometimes it's super busy and nobody has time to take care of that little youngster that they're supposed to be shadowing. Other times it is, they got there and they finally got an opportunity to go on, go to breakfast. And so their mentor's off at breakfast. My student still needs to stay busy. So these are questions that the kids can, you know, stop and look and examine and try to fill in at that point. The other nice thing about this, a particular type of worksheet, the workplace discovery one, is let's say you have a student that isn't able to go to the clinical area. This is one of the ways that my students will still have to fill this out. They're going to have to go to Dr. Google or, you know, several different sites to try to find the answers for this because it's going to replace a grade for them in, at least in my classroom, of you know, that day that they had to miss clinical. So that's it in a nutshell.
Okay, I'll do the task sheets really quickly. Those go along with the two worksheets that Linda just talked about. These are to use in the clinical setting, and they're really designed for your clinical affiliate to use kind of as a starting place. So it'll have different skills or procedures they might see in that area. There's a column for observation and a column for assisting if they actually get to help with that skill. And it's just kind of a guideline to help the student and the whoever's their preceptor have a starting point and look at some things that maybe they can learn in that area if they're running short on ideas. And again, that they don't have to stick just to that, and they might not see everything on that task sheet, but it's things that are common to that area. And it's also really useful to use at the end of your clinical session. The students can use those to give report and kind of get used to doing that aspect of communication and report back to the instructor what they did and what they saw during clinicals that day. And that just, you know, increases their verbal skills and also you get to hear about what they did at, for their experience that day.
Whoa, impressive. You got through all of it. And we're at the top of the hour. If anyone has any other questions, feel free to put them in the chat. And I think we can probably see those after the webinar as well. But if you want to download the slides that we shared, which had, you know, some examples for bell ringers and scenarios and things you can use, feel free to take the link in the chat or that you see on the screen. We can send this out afterwards and give it to the National Consortium to send out to you. Great. Where are all these sheets? So all of these tools that they were talking about are actually being created now. They'll be available in clinical and employability skills for health professions next December, but we'll be sending out some sneak peeks with full sample activities throughout the summer and the early fall. So if you registered here, we'll make sure that you receive those. And I did make a promise to give more instructions for that soft skills stations lab, so you guys can try that out in your class. Linda, Kim, and Deborah, thank you so much. If there's anything else you wanted to share, there was a lot of information shared, and we're so excited to see what you're working on.
All right. Thank you so much, all of you ladies, for all that valuable information that you shared with us. I know I was writing kind of furiously and stuff, and I really was excited about that station lab. I want to put that to work right away. But I wanted to remind all our participants that the next Wednesday webinar will be on April 24th. It's kind of our end of the year's celebration as we start working into the May and ending of school year, kind of depending on when your school year ends. I know we have some schools here that end before Memorial Day, we are after, so we want to kind of have a celebration and wrap up in our next webinar. You will receive, as Shelley put in the chat, you will receive your certificate of PD with the PowerPoint presentation within 2 weeks of this webinar. And don't forget that the National Consortium Annual Conference is October 15th through 18th in Glendale, Arizona. There is a letter to attend template on the NCHSE website if you need a little help talking your administration into allowing you to go. And there is so much good information and good activities that you'll get at that conference that you take straight back into the classroom. So we hope that you will consider joining us there. If there are any questions, I know everybody's still here. If not, you are free to go enjoy the rest of your afternoon, and we do appreciate you attending with us today. Have a great afternoon. I was about to say, Abby, if you want to stop sharing, well, and then we got to figure out how to stop recording.